I'd like to introduce Karen Petruccelli. She is the Vice President here of Clinical Quality and Education for Legacy Life Care. She has an extensive background in clinical and nursing administration in both the acute and long-term care arenas. Karen has held positions in the areas of infection prevention, staff education, and as Director of Clinical Services for a multi-state long-term care organization. In addition to teaching didactic and clinical instruction for practical nursing students, Karen has also functioned as a curriculum and corporate educational development specialist. Ms. Petruccelli is a current member of the American Nurses Association and the past member of the National Association of Director of Nurses, serving as the educational coordinator for the state of Connecticut. Graduate of Quinnipiac University, Karen holds a Bachelor of Science degree in nursing as well as a Master of Science in Nursing Education. She lives in Connecticut with her family. Now, I think that, all things COVID, Karen was thinking that this was a basic presentation, but I know that looking at this and looking at going over it with her yesterday, there was a lot of really good points that helped validate, because we're going through such a tenuous time and we're coming into flu season. I thought it was really good timing. So let me just share my screen. So Karen, thank you for being here.
Thanks, Marianne. Hi, everybody. I'm Karen Petruccelli. This is the first time that I've had the opportunity to sit and be a part of a Rotary meeting. And it's so impressive, the things that you do. They're so kind and they're so community spirited. And it was really interesting to be part of your meeting. So thank you for having me. As Marianne spoke about, we were going to talk a little bit about COVID and some of the infection control things surrounding it. Please feel free to ask a question or just have an open discussion as we go along. So we're going to talk about safety through COVID for you, for your loved ones, for your customers, for your clients. And a big question in everybody's mind is the upcoming flu season. So we start, Mayor?
Mm-hmm.
So just to take us back and put this in a perspective, wasn't this long ago when the Patriots, a football game looked something like this. But now, that was then, and this is now. And obviously, the Patriots are, having their own concerns right now with their quarterback testing positive. And then the NFL with the new rules and regulations of testing before every game, and truly strict fines for managers and coaches and sideline people who aren't appropriately wearing masks. And that may be a reflection of what's going on in our community in other areas besides just sports. So just a timeline, if we think back a little bit, not all that long ago, less than a year ago, on January 9th, there was a mysterious coronavirus that was noted in Wuhan, China. It's important to say that coronavirus, and you may have read this, is not just COVID-19. A coronavirus is a group of viruses, and one of those viruses is the common cold. So nobody knew exactly what was going on at that point. It was early on. In January, later in January, on the 21st, the first case was noted in the United States, and that progressed. More and more people became infected, became ill with the disease, and on February 3rd, a public health emergency was declared in the United States. Parlay that into the world, and on March 11th, a pandemic was declared by the WHO organization. I think, did you go ahead, Mayor?
Yep, sorry, I went.
That's okay.
Yep.
One back, one more. And then on the 13th, a national state of emergency was declared by the president for the United States. So coronavirus was then named novel coronavirus because people didn't know exactly what it was. It was different than the other coronaviruses that were experienced in the world. And then that evolved into COVID-19. And that's primarily what it's known by throughout the world right now. So there's a lot of classifications and words that get thrown around, and those are basically negative, positive, recovered, and quarantined. So what do those mean? So negative, there's actually two definitions to negative, but a true negative is a person who's never previously tested positive to this point for coronavirus or COVID-19. Another classification for negative may be somebody who had the illness and recovered and actually had an official swab, an official test, and was declared negative at that point. It's important to note that people can have COVID, get well, be declared recovered, and could still test positive for the virus. That doesn't mean that they're contagious at that point. It means that they're still shedding some of the virus in a non-contagious state. The next classification is one that's, everybody's heard, everybody knows, and that's somebody who's positive, somebody who has coronavirus, COVID-19. There's three categories in that. One is symptomatic, and those are people that are sick. They're sick with COVID-19. They have the symptoms that we've heard about, that we've learned and listened to on television and through our readings, and that's respiratory distress, a high fever, a headache, a cough, shortness of breath. Important to know with that is that there's other symptoms too. There's just a litany of them. GI symptoms, nausea, vomiting, diarrhea, all those kind of things too can be, not always, but can be a symptom of COVID-19. And that's one of the things that makes this illness so precarious, because especially this time of the year, fall, people are sneezing, people have allergies, colds are starting to set in our area of the country. Is it COVID? Is it just the common cold? Nobody really knows. So the other category is asymptomatic, and there are people who are tested either through their work, through going to school, surveillance testing. They have no symptoms whatsoever, yet they have the virus. And that's one of the other areas where it's such a concern, because as you know, we can be with someone who's asymptomatic and who's actually contagious and not even know it. And the final category is pre-symptomatic, and that's people who are tested, and at the time they're tested, usually through the surveillance testing at schools, at work, wherever, and they have no symptoms. 2 days later, 3 days later, they start to show symptoms. So, that's another area that makes this virus so challenging, to try to determine who has it, who doesn't, when people have it and they aren't sick at all. And then the last one is basically quarantined, and that may be for many reasons. People are quarantined across like the healthcare continuum, people who may go to the hospital and then for a non-COVID reason or a COVID reason, and then come to long-term care, go to assisted living. People who are entering assisted livings, long-term care from home, they need to be quarantined for 14 days. We don't know their status right now. We don't know whether they're positive, negative. We probably would know if they were recovered. But the whole point of that is if they've never had the virus before, to make them safe. And if they've acquired it in the community, to make sure that people in the healthcare facilities, other patients are safe. And people possibly who have traveled from another area besides Massachusetts or the states in New England right now that are classified to be not high risk. And that includes all the states except Rhode Island. We're going to talk about that a little bit later. When they come back into the state, if they have, excuse me, they would need to quarantine for 14 days if they've been in a high risk state or have a negative test. So what is close contact? How do you know if you've had close contact with somebody who you do know has COVID-19? And pretty much the definition right now, though this is ever changing, is 15 minutes contact within 6 feet of the person. And that could be that you were caring for the person, somebody needed assistance with something, that you used the same utensils, you drank out of the same straw, that kind of thing, or you were sneezed or you were coughed on by someone who's known to be positive. And then we have recovered. That's people who have had COVID-19. They've had an improvement in their symptoms. They've had no fever for 24 hours, the past 24 hours, without using Tylenol, aspirin, Motrin, that kind of thing. And it's been 10 days since the positive test. Right now, the length of immunity is unknown. There's all kinds of things, all kinds of information out there, with pretty much 90 days being the point right now. But again, the information is ever changing. So if you've had COVID-19, will you never get it again? Nobody knows right now. There is research that does show you have a length of immunity for at least 90 days. So what keeps you safe? All the things that we've heard about, and they truly do work. So hand hygiene. So when you wash your hands though, and you perform hand hygiene, it's important to do that for at least 20 seconds. And 20 seconds is a long time when you're washing your hands. You know, we wash our hands before we eat, kind of put them under the water, use some soap, and 10 seconds have gone by. To really be effective, it should be 20 seconds. And the reminder that we use is to tell people to sing the happy birthday song in their head. And that's usually about 20 seconds. The same goes with alcohol hand-based sanitizers, 20 seconds for that use. And with that, you need to make sure that you really get every surface of your hand. So the palms, each finger, that kind of thing, to really have the hand hygiene work for you the way you want it to. And the hand-based sanitizers that you use would be the most helpful if they had a base of at least 60% alcohol. So what else? So your mother was right, mostly. Respiratory etiquette. Remember, our moms told us to cover our hands and our nose and our mouth, with our hands. Well, obviously we don't want to do that anymore because the droplets are coming from our nose and our mouth, and they're going to get on our hand and we're going to spread the virus. So what we want to do is use that elbow sneeze that we're all used to, that the little girl in the picture here is doing. And when we put a mask on, we want to make sure that we put it both over the mouth and over the nose. Half masks, they don't work. So what else keeps you safe? The environmental hygiene. Make sure that the environment that you're in is as clean as it could be. And there's just basic cleaning, you know, common sense. You want to make sure that you wipe down the tabletops, that you're wiping down appliances that you're using, that you're wiping down phones, those kind of things, to keep them clean. And we'll talk a little bit more about cleaning as we go on. And then social etiquette, you know, the elbow shape. There's that elbow again. No foot tap, wave, head nod, everything, but not what we all know, and that's handshaking. And it still amazes me how much it's ingrained in us, and that I have to think before I go to, and I meet someone, my first instinct is to shake their hand. And you have to step back and think about it to keep these things in the front of our mind. We want to social distance from each other. The rule of thumb right now is 6 feet, though that's changing a little bit. You know, there's some data, some evidence that's come out that's saying that really 6 feet, the virus may still live more than 6 feet, and to wear a mask. And the last, and certainly the most important, is if you're not feeling well, stay home. Just, you know, stay home. Don't expose others to your illness. Take care of yourself. Call your physician, call your healthcare provider, find out if you need to have a test. As we talked about before, you know, it's fall, there's all these other symptoms coming around and nobody knows. There was a healthcare facility in Upper New England that actually a nurse came to work, felt really fine, had a few sneezes, said, I just have allergies. They continued, she was tested. She exposed many people in the healthcare center there. And it got quite serious. So if you're not feeling well, stay home. in healthcare, there's something called standard precautions, and that's where we just treat everybody as if they're infectious. You may have an illness, you may not, and that goes for any illness, not just healthcare, or not just COVID. Same thing in the community in COVID times. Treat everybody as if they're infectious. Keep that 6 feet distance, keep that mask on, wash your hands. Better safe than sorry. You see all the different things people are doing to protect themselves and protect others. Schools, mothers, daycares, they're teaching children to wear those masks with using teddy bears, using dolls, that kind of thing. You see this other picture on the lower left of a family that's together. They're not 6 feet apart. They're out, they're walking, they're still wearing a mask because they're outdoors, and it's a mandate in Massachusetts. And then up over on the right side, you see people that are out, they know each other, but they're socially distancing and wearing a mask. And then the screening that goes on in schools and businesses and healthcare facilities and some restaurants, some hair salons, that kind of thing, to make sure anyone coming in is as virus-free as can be, as we can assume they are. How about our pets? So the reality of it is they can be infected. I remember really early on in this, being on a call, and a news flash came over from the Bronx Zoo that a lion there had tested positive for COVID-19. We were all stunned. We're like, oh my gosh. But they have the same symptoms as human. It appears the virus can spread from people to animals, and it's important that if we're positive, one of us is positive, a human is positive, and we have pets, we should try to restrict our interaction with them if it's possible. So what's going on with face masks and crowds? You see some people with them, you see some people without them. So the truth is the potential for spread is diminished when we're wearing a mask. No doubt about it, it's diminished. When we're talking and we have a mask on, the droplets that come out of our nose, come out of our mouth, are more contained inside of a mask. And there is evidence now that we talked about a little bit earlier that the virus hangs in the air for longer and farther than 6 feet. So you hear things about the virus is airborne, the virus, it actually goes more than 6 feet. The reality of that is it probably does go farther than 6 feet. But when you talk about airborne, it doesn't mean that we have to really be worried about things going through air ducts and that kind of thing. That has not come out officially yet. So social distancing is important, masks are important, and hand hygiene especially important. When I was first in nursing school many years ago, I had an instructor who said to, I think it was my fundamentals of nursing class, if you ever aren't sure whether you should wash your hands or not, just do it. And that's certainly something we should all be doing right now. So how do we clean? What do we use? Stores have had runs on things. Remember in the beginning, nobody could find any toilet paper. Sometimes people can't find any Clorox wipes, that kind of thing. What happens next? So first we're going to clean to remove the germs, and then we're going to use disinfectant chemicals to kill on surface. The chemicals that kill COVID-19 are on an EPA registry, Table N in the CDC website. If you can't find things in the store, you would just make a bleach solution of Clorox bleach, any kind of bleach, of 1/3 of a cup. If you read the label, it needs to contain 5.2 to 5.25 to 8.25% of sodium hypochlorite, and it'll say it right on the label, per gallon. And you take 1/3 of a cup of bleach, put that into a gallon of room temperature water, and it's effective for up to 24 hours to spray and clean. You may have seen some pictures of fog machines. Those actually have chemicals from that Table N that attach to them, and they spray on surfaces in the environment. So you see the picture of the bubble here. Do we need to go into a bubble? If we're not a high risk, probably not. But we absolutely need to take every safe precaution that we can. Again, that 6 feet is enough. It's getting cold, and now that just add another kink into the armor. Now we're all moving indoors. We were kind of outdoors for a little bit of the summertime, you know, some interaction, and now we're moving back inside. So what now? Can we hibernate? It works for the bears. I'm not sure it's going to work for all of us. Again, your hands, social distancing. Look around. Now that stores are open, restaurants are open, hair salons are open. Use common sense. If the place looks overcrowded, for your comfort level, consider your options. And then, is everyone wearing a mask? And are they wearing them correctly? Look at this first picture. So yeah, the mouth is covered, but the nose isn't. And the second one, that's doing no good. That's a kind of Grey's Anatomy, a Chicago med squad kind of thing. They don't work. So flu's coming. Do we vaccinate or not to vaccinate? Definitely for people who contract COVID-19 plus the flu, there's a great potential for more serious respiratory outcomes. You know, your body's in a weakened state from COVID or from the flu, and you contract another, that's putting another additional stressor on your body. The flu vaccine's been around a long time. Sometimes the flu vaccine hits the mark, and we have what's called a light flu season. Not a lot of people, because it's very, very effective. Other times, not so much. This year, adults who are 65 and older with an order from the doctor can receive a higher dose of flu vaccine to help fight any signs and symptoms or any flu along with COVID, though the flu vaccine does not help COVID. And anyone considered high risk can. Other people receive the normal dosing. Also, anybody 65 and older, it's important to make sure you talk to your doctor about a pneumococcal vaccine to prevent against getting pneumonia. So what's happening with COVID vaccines right now? A lot of talk out there about them. Right now, there's 4 companies. They're in phase 3 of a clinical trial. Some have developed them as a one-time dose. Others have developed them as a series of 2 doses. The time frame truly still is anybody's guess. If you listen to the media, you know, it's possible that we would have this very, very soon. It's possible we may not have it till the end of this year. The question then becomes, when are we going to have it for everybody, so that that infection is just really wiped out as much as we can make it be wiped out. Children with vaccine, to absolutely declare safety for children, that's probably going to take a little bit longer. So how are they treating COVID right now? I'm sure you've all read that with the hospitalization of President Trump. Zinc, melatonin, those are things that help to boost your immune system naturally. They use an immunosuppressant, which helps to bring down the immune system a little bit once you contract a disease, and that's the hydrochloroquine that we all heard about. Sometimes it's not the COVID-19, that's the problem, it's the reactions from the COVID-19. So your immune system goes into overdrive, and you start to have all kinds of complications because of that. So an immunosuppressant may help that. There's anti-inflammatory drugs. An example of that is colchicine, that's used for gout. Antivirals, the remdesivir. Steroids, which also helps to decrease some of the inflammation in the body. And then the trial drug that is strictly in trials right now, President Trump did receive it, that's Regencov-2, and that's where manufactured human antibodies manufactured in the lab are given to try to raise the antibodies to fight this disease. It's important to know that nothing is definitive at this point as a strict treatment. There's protocols, but what may work for me may not work for you. So it's an individual kind of thing where you are in the process of the disease. So if we all go back to March 23rd again, everyone remembers the Massachusetts executive order to close all non-essential businesses across the Commonwealth. And I think we were all shocked. You know, we kind of knew it was coming, but wow, the reality hit home fast. So fast forward a little bit to July, the current state we're in right now. In July was phase 3, step 1 of reopening. And last Monday, lower risk communities are permitted to move into step 2 of the phase 3 opening of the Commonwealth. So what are some standards that we do in the workplace to keep people safe? Again, they're the ones we already talked about, the social distancing. In this instance, though, the employers need to establish protocols to ensure their employees can practice and work easily and effectively. So they are social distances. They do have masks. They do have what they need to take care of themselves while they're at work. It's important to have signs up to remind them of this safe practice, because just like that, you normally go back to, I'm going to shake this person's hand, and then you kind of say, no, I can't do that. People need reminders, because as this becomes more and more commonplace and we're reopening, we still need to protect ourselves while this virus is still among us. Face masks are required. If they're like the surgical face masks, they should be changed every day. If they're cloth, they should be cleaned daily. And then hand washing capabilities throughout the workplace, throughout the work environment. Again, that doesn't necessarily mean a sink for soap and water every so many feet. It doesn't. Alcohol-based hand sanitizers are sufficient. The only times those don't work is when someone's hands are visibly soiled. So the other thing is the regular sanitation of high touch areas, the cleaning of that, the elevator buttons, the doors, doorknobs, the doorknobs to bathrooms, doorknobs to employee break rooms, toys for children, that kind of thing. We want to improve the ventilation we can, and you could do that simply by opening the doors and the windows. An entry lock for contact tracing. For people who enter your place of business. And every workplace should have a control plan for reopening. It needs to be on the premises, and a compliance attestation poster. It should be signed and posted for auditing purposes. And your clients want to hear from you personally. You might want to think about adding a safety video to your website. Doesn't have to be anything lengthy, short, to the point, what you're doing to make people feel secure, and actually what your expectations are of anybody entering your workplace. And you want to show them your dedication to their safety as well as your employees. There's a safety video that was put together for JGS Life Care in Long Meadow that could be accessed through our website. And what about those travel restrictions? Okay, we all wanted to get away a little bit in the summer. Some of us managed to, some of us didn't. But what's happening now? It's different than it was in the summertime. So where can you go? You see that map now. Now, when Marianne and I were putting this together, I think late last week, there were more unrestricted states. We looked at it again yesterday. More states came on this list of restricted. So you see they're all New England states with the exception of New York. And Rhode Island is restricted for Massachusetts. The numbers change daily. Check out that recent data. How do you become a lower risk state? On average, you have below 6 daily cases, and the positive test rates are below 5%. Otherwise, it's recommended that you quarantine for 14 days, or you produce a negative test result no more than 72 hours old. That said, it's also important to remember that a negative test, is only a snapshot in time. Even with a negative result, that within 14 days, you could still show symptoms or turn positive. So these are some places that you can look for more information. You've probably already been on a lot of these. The CDC, they update daily. Mass.gov. Under the DPH website, they have a COVID-19 dashboard with all the numbers in the state, and a weekly public health report is released every Wednesday. It shows us counties where things are possibly increasing or decreasing. And then this is just a list of the references used to put the PowerPoint together. Thank you, everyone.